I am Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here, I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient, 54-year-old lady suffering from varicose vein both the legs for the last 24 years. More on the left side, and in the left side it is in the stage 6 actually, recurrence. Stage 6R means usually when there is bleeding, it has blood or ulcer is, ulceration of the skin is taken as varicose vein stage 6, and if the recurrence of ulcer is taken as stage 6R. She is in that category actually. She had undergone laser surgery and also sclerotherapy many times in fact. Skin lesion on the leg is, the ulcer is for the last 2 years there is ulcer, and it is not healing for the 1 year. 1 year it is, she is continuously ulceration. Before that it is come on and off ulceration and then it is healing, but the last 1 year it is not healing. And she is advised to undergo again surgery, that is she said there is glue therapy, the latest methodology is glue therapy for the both legs, and skin grafting for the left leg with the non-healing ulcer. And along with this varicosity problem, varicose vein and ulcer problem, non-healing ulcer problem, she is obese and also she is hypertensive. She is 180, initially when we were recording, it was 180, 120. And actually she was taking many medicines and finally she was found that she doesn't have any effect on with the medicines itself. So she completely stopped the hypertension medicine also. And on the ultrasound scan, and she is having a small abdominal hernia also, and this scanning also there is a hernia that is there for the last 10 years, and she is advised to have the surgery for the umbilical hernia too. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in periodic tests. When we come into the details of the patient, she is a 54-year-old lady, height 162 centimeters and weight 80 kg. Her real age is 54, but her body age is 70 actually. It's almost 16 years accelerated aging is there. And her abdominal circumference is 100 centimeters. She is having abdominal obesity, and the fat percentage is 39.3%. Ideally, lady should have around 25% fat only, but her body is having almost 40% fat. So her problem started around 24 years back with varicose vein. Actually, during the pregnancy she developed the varicosity, and it was gradually increasing, and for the last 2 years she is really suffering. And she had got this ulceration, and she had undergone surgeries also, laser surgery and also sclerotherapy. 3 years back actually she undergone these surgeries, and actually after that this serious problem started. And the skin lesions, there is for 2 years there is skin lesion, and it is non-healing ulcer. It is for the last 1 year it is not healing, a major ulcer is not healing. And now she is advised to do another type of surgery for the varicose veins. Both the legs varicosity is there, so she is advised to undergo glue therapy and also skin grafting for the non-healing ulcer. And basically she is obese, definitely she is overweight, with especially abdominal obesity is there, and hypertension. And she had, at a time she was taking medicine, but now she stopped. Even with the medicine also she is not getting much relief, and she is more worried about the pain and discomfort on the leg actually now. And the hypertension, when we are examining her first time, it was 180, 120, it's very high BP is there. And she is having umbilical hernia also, and she's advised for undergo the surgery, but she was postponing it. And she's having constipation and piles also. Actually, piles also, it is another type of varicosity. The varicose veins is on the leg, and it is the varicose. This abnormalities in the blood vessels is also the one of the cause for the piles also, actually hemorrhoids, what we call. Next is this disease actually comes according to the newer understanding. Her problems comes under one is metabolic syndrome, part of the metabolic syndrome, and she is abdominal obesity and hypertension is there. And also this varicose veins are considered as autoimmune disease currently. It is actually what is the reason for varicose veins is that there is a abnormality. It's actually coming under the collagen. It is the veins are made of special type of protein, mainly collagen actually. There is an abnormality in the collagen formation, and that is actually this veins become dilated, and also there is high pressure. Another reason, actually, there is the structural damage in the vein is there, so the valves are becoming incompetent, and also when the overweight is there, the abdominal obesity is there, the venous pressure increases. So it will add the abnormality with the damaging the valves are there in between. Actually, when the blood flows up, there is a valve to prevent the flow down. But in this varicose vein patients, this valve will get damaged and start leaking. So the blood comes up, but it goes down also. So finally, the blood will not be pumped into the heart. We think of the pumping of the blood from heart to other parts. But when it comes to the leg, it is actually our leg muscles act as the pump. And when you are obese or when you are sedentary life habit, these muscles also become weak, and also the pressure increases. That is another reason. So it is multifactorial. These varicose veins are multifactorial actually. Next, when we come to the what are the symptoms for her, or what are the discomforts? Basically, the ulcer and the pain is her major concern actually. And there is the leg, both the legs are discoloration, darkening is there, and especially more on the left leg with the ulcer, and the leg edema is there, and her abdominal problems. She is having gas problem is there, and so constipation and the piles. And medicines, actually she is not taking much medicine at all. For the BP also, if she has hypertension, but not much medicine. She is taking some painkillers, and also the ulcer is dressed with some antibiotic sort of thing, and also elastocrete bandage to make it more presentable also. Elastocrete bandage over the dressing is there. And when we check into the blood, she's having dyslipidemia is there, to her cholesterol and triglyceride is high, and uric acid also is high. That is also a part of the metabolic syndrome. She's already having BP also. So most of the patients with the BP will be having this cholesterol also high. And HSCRP and ESR, that is the two inflammatory markers, that is both is high. And for this sort of patients, we check for the food intolerance and the allergy part also. So on that examination, she's having allergy to many food items like sesame, tamarind, yeast. Yeast is used for the bread and appam, and most of the preparations we use the yeast as a fermentation agent. She's allergic to that, and also dalchana is a very common food among Keralites where I'm practicing. Actually, dalchana is very common for the Indian food, and groundnut, she's allergic to that, and also some respiratory allergy also, dust mite and paper dust, paint, etc. also is there. And also she's body is reacting to IgG is positive for almond, beans, egg, pea, so many items, soy, orange, and many fruits and vegetables also, plum, wheat, milk, so many items she is allergic also. That is also very common. Most of this allergic disorder, not only for the allergic disorders, for those who are having autoimmune disease and also cancer patients also, we see that they are actually intolerant for many food. Actually, this intolerance is adding strain on the immune system, and finally, it is an immune system problem. Any disease is actually your immune system is not working properly. That is why you're getting a disease. And either toxins or this sort of intolerance to food can be a reason for that. Next is ultrasound scan. In the ultrasound scanning, she is having a fatty liver and also slight enlargement of the uterus with few fibroids. That's not that significant at this age. And umbilical hernia, almost 1.3 centimeter sized defect. And it is omentum and bowel loops are there inside that. Then when we come into the clinically supported lifestyle correction, in clinically supported lifestyle correction, what we try to do is to correct the body composition and correct the immune system. So you had to correct the immune system, then only you will be able to get cure from any disease. You have to balance the immune system. And also in this case, the increased venous pressure is one of the reasons for the varicose vein. One is an autoimmune process damaging the veins, and the other is obesity. So we had to reduce the excess fat in her body also. So we are giving a low calorie diet, but ensuring all the nutrition in her food, and especially to special care is given to avoid inflammatory food like this food with high omega-6 fat. Omega-6 is the inflammatory component of the food mainly, and also toxins. To avoid color preservatives, tastemakers and all in the food, and also to increase the omega-3 content, that is anti-inflammatory, and reduce the omega-6 content, and the low calorie food to reduce her weight also. And also we try to make them do the exercises also, that is in a lying down position or sitting position, do exercise to stimulate the muscles. Only through the muscles we can activate any part of the body. Only according to our wish, you can work only the muscles or the skeletal muscles. When we do the skeletal muscle exercises, the calorie need is increased and the blood circulation is also increased, and you will be able to burn out the excess fat in the body. Next, what about the wound ulcer care actually? She was using some regular antiseptic dressing and all. But for the wound care, the ulcer care, in the clinically supported lifestyle correction, what we do is, we don't use any antiseptic and all. It is all usually antibiotic and all, because most of the patients coming for this support will be chronic patients with so many antibiotics, so many antiseptics and already used. So we use only saline for the cleaning. This saline water, this concentrated saline, around 5% saline is used for cleaning in the wound and disinfecting it, and apply special nutritional oil for the dressing. So the oil will prevent these bacteria and fungus and all will not survive in the oil. So give special nutritional oil for that contains mainly the omega-3, 6 and 9 and fat soluble vitamins. So the skin will be getting direct nutrition from that. And also it will repel the microbes also. So that is given, no other special things. With that, ulcer care and this special nutrient and the special exercises, actually from the 8th day, actually her most of the symptom, abdominal pain, constipation, swelling of the leg and all is almost 50 to 70% relief was there. But the ulcer was not healed. 20% reduction in the ulcer was reducing in size actually, and around 20%, and the discoloration of the leg and all persisting, but there is relief. And by 15th day, that's all other symptoms other than the leg ulcer and the discoloration, everything is gone. She is comfortable, no pain, discomfort, and no edema. That is another problem is the edema of the leg also will be a problem for the varicose patients. So that discomfort part is over, but the healing was gradually, it was completing. And actually by the 60th day, it's almost clear. By 90th day, the ulcer is healed completely. Till ulcer is healed, it is that dressing was given. But after almost 60 days, there was only even the saline water cleaning and dressing is over. Only application of the oil there for the whole leg, especially the dark one part, that she has to repeatedly do. So that is actually functioning as a protectant and also as a nutrient actually. Next, what was the test-wise, what was the important? The cholesterol and the triglyceride became normal in the next visit, 8th day itself, and the cholesterol also came down without any medication to 195 by the 15th day itself. Uric acid also came down by the 30th day, and HSCRP and ESR also was gradually coming down. By that also, because it is the active ulcer also, the ulceration also is there, so it took some time to correct it, but it is also by 90th day HSCRP was normal, and ESR was also came down to initially 75, then 15th day itself 40, but it was not come to 20 and 25, 15 is the normal range. But this sort of autoimmune diseases, it may not come down to that normal level, but it is okay, 40, 46 and all okay. Next, when we consider what are the body changes, actually we are focusing on the body composition. In the clinically supported lifestyle correction or in the lifestyle modulation for a lifestyle disease patient, when we are focusing on the body, actually her initial weight was 80 kg and her BMI 30.3 and her BP was 180, 120. And abdominal circumference 100, body age 70. She is only 54 years, but the body age is 70 and is 16 years accelerated aging is there. And fat percentage is 39.3. Ideally, it should be around 25 only. So, when we consider the weight, she is able to come down to 74.6 by 30 days. And 60th day, 71.3. And 90th day, 68.7. And by 180, 65.3. Actually, if the patient is so correctly following, it should have gained this weight reduction by 90 days itself. So, ideal patient, if the patient is doing all the exercises correctly, at least 2 hours for the special exercises and also following the diet perfectly, then they will be able to get around 20% weight reduction. But that she was not able to attain, but she is able to get a 20% weight reduction by 180 days. But first month she covered almost 6 kg, she was able to reduce. Next, about the BP. Her BP was so high. Without medication itself, BP was come down to 130/90 by 30th day, and then it is come down for gradually by 90 days, it is 120/80. The BP also, the gradual, that is the weight, this body correct, when the body is corrected, that fat is reduced, the hormone systems will be getting corrected. Actually, imbalance in the hormones and the chemicals inside the controlling, there are so many hormones which is controlling the BP. That imbalance in that and the inflammation is the reason for BP also. BP also is an inflammatory disease. So when the body is corrected, BP also got corrected. She was not able to get a control of the BP even with medicines. That's why she is not taking any medicine. Actually, she is in the working in the field of medical professional itself. Then her abdominal circumference, she is having abdominal obesity. Abdominal obesity is one of the reasons for this varicose vein and ulceration and all. Since beginning it was 100 and by 30 days it came down to 93, by 60, 90 and 90 days 88 and 180 days 84. So it also almost 16 centimeters reduction of the waistline also. And the body age, actually the accelerated body age, that also we can reduce with the corrective lifestyle modulation. You can actually become younger. So she had actual accelerated body age was there. She was real age is 54 only. Initially it was 70, and by 30 days it came down to 68, 60, 65, then 90, 63, and 180 is 59. But she has to improve again. So it is now she's only 54. So that weight reduction is not as ideal. So she needs to reduce another and the fat percentage. Actually initially it was 39.3% and came down to 33.6 by 180 days. But she has to reduce that also. More fat has to be burned. And maybe around another 10 kg she has to reduce. Her height is only 162 centimeters. So her ideal weight should be around 50 to 55 will be there. So if she can come down, definitely she can actually come down, reduce her body age to below 50. She's 54, but that is what actually we are aiming in the lifestyle modulation. With the clinical support, there are many people who has come down their body age to below what is really. There are people who can even come down 50 years, they can come down to 40 years and all. That's all depends on their interest and how much help the patient want. That is the it's all some people may not like to reduce much of the fat because they think that having some weight and some fat is the sign of beauty. That all depends on each person actually. Now, what is the benefit of lifestyle modulation compared to when we compare to modern medicine treatment? Actually, she has tried not only modern medicine, she has tried Ayurveda, homeo, and all sort of things. Even there are treatment which is applying leeches on the varicose vein and all. Some sort of Ayurveda treatment and other traditional treatment. She has tried all that. Actually, with this, actually, she is able to get within 2 weeks itself. She is able to get a comfort level with the relief of pain and edema and discomfort actually. And by just having this non-healing ulcer for the last 1 year. Now, without any surgery, any skin grafting, she was advised to go for a skin grafting. Without any skin grafting, she is able to clear the ulcer within 30 days. And no need for another surgery. And along with that, her hypertension is gone. Hypertension without medicine, even with medicine, it was not getting corrected, and now the hypertension got relieved. And the skin only thing, even she's not thinking of an abdominal surgery with this umbilical hernia, because this umbilical hernia is projecting because there was no space in the abdomen because of the obesity. When she's able to around 50 kg reduction means those things will get corrected, and also not only the fat reduction and also abdominal muscles are getting strengthened, so that any divarication of the rectum, that muscle divarication or any problem in the abdominal wall also will be reduced, and also there is nothing to push come down because the abdominal pressure is reduced. The bowel and the fat is getting into that herniated sac also will be reduced. So she doesn't consider it as a problem after coming down to 65 kg within 6 months. And also note that the abdominal discomfort and also the constipation and piles also reduced. Not reduced, it is only if it is few food items. Actually, it is also related to food, this piles. And now she is able to, because of this clinical monitoring and all, she is able to recognize which food is creating problem. So, and also we had done the test and the avoiding whichever is creating problem. So she is come out of that also. And there is no need of any bandage or dressing or even the elastograph bandage. Nothing is needed now. Next, what is the future? What he has to do in the future? See, in this sort of patients, she has to reduce some more weight. That is, she can actually, with her height, she should come down to around, ideally, she should keep her weight around 55. And the fat percentage also, she has to bring down her fat percentage to less than 30 anyway. And now, last with the 33.6 is there, she has to bring down it to less than 30 at least. Ideally, she should keep it around 25. In that case, she will be able to reduce her, if she achieves that, her body age also will be reduced to below 50. That is really 54, and now with initially 70, now her body age is 59, and now she will be able to come down another 9 years if she is stick to the exercise and the food regime. And for the future, keeping that, and also she should avoid the food which is reacting to her. But after everything is get corrected, she's got her body composition and all is corrected, and she can, maybe some of the allergies will go off. But if you take something, if for example, if you have initially allergic to milk, and after everything is settled, you can take milk once in a while. But if you are taking every day, you have to start drinking milk and milk products and all taking, then the problems will come back. So you should be careful to avoid the other intolerant food and also this other toxins, color preservatives, such things also you should as much as possible avoid. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Devara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases, and come out of medications. To protect your children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.